Hi, I'm Dr. Rafi Romano. I'm very pleased to present you today clear aligner treatment for adult patients with periodontal disease, which the consequences of this disease was opening of spaces in the upper and lower front teeth. And these spaces are very common to adult patients which have some migration of the anterior teeth due to the periodontal disease. Now, once we are in consultation with the periodontist and we preserve a good health of the periodontium, regardless the very small bone support, we can go and treat these patients with orthodontic treatment. My choice was to do an clear aligner treatment. In this case was Invisalign, because the Invisalign is actually wrapping the teeth from 3 dimensions, not only like a bracket which covers merely few millimeters from the tooth, but by covering the teeth from the buccal, from the lingual, from both sides, and we are avoiding the jiggling of the teeth while they move. Now you can see here the plan, and we divided the treatment for almost 2 years, which means that every movement was very, very minimal. And on that time, we preserved some splinting of these 2 arches to avoid both the jiggling or the traumatic movement, and to enhance the biology, which in this age is not so fast and not so predictable like a young patient. So you can see here the patient during the treatment, following slowly the one aligner after the other. You can see how the aligner fit really good, which means the cooperation was perfect. And we got a very, very good predictable movement from one aligner to the other. And you can see here the treatment slowly. I will follow with the slides how the teeth slowly go inside. I've planned the lower teeth to move before the upper, so we get a good overjet and not get a traumatic occlusion. So you can see here slowly the case before, during, how the teeth are going inside, slowly, slowly. Every time we progress more, you can see here how the lower teeth go inside, slowly, more and more. You can see here how the roots are parallel, which means that the spaces are closed. Bodily movement, very, very slow. Because of the angle of the tooth, we get now more growth of the bone and more bone support. And this is something that with biology, proper biology, we get only improvement. Many patients and many doctors, referring doctors, are afraid that the orthodontic treatment will jeopardize the periodontal support and the bone support of the teeth. But on the contrary, we get much better bone support and whole soft tissue support for these teeth while we move them. And you can see here slowly how the case proceed. I'll go, you can see month by month, and you can see here really nice periodontium, really nice occlusion, really nice midlines. And here the case was finished. I put a wire, a retention wire, and I gave the patient some aligners to wear at night. You can see the before, you can see the after, and here is 1 year follow-up where the patient is still wearing his aligner at night. Case is really preserved and really, really nice, both occlusion and aesthetic. You can see here another example of a patient with a very big diastema. Almost you can put an extra tooth between these two centrals, and you can see again a long treatment, almost 2 years treatment, slowly closing the space, building the papilla between the teeth properly, as you can see here. And this case is also now 15 years in retention and very stable. And the patient started the treatment at the age of 66. Which is now almost 80. So I think that this gives the message properly on how to treat clear aligner with periodontal patients. Thank you, and I hope to see you again in my next videos. Bye-bye.